Alright, so we're coming into the home stretch here on these physics videos, and we've come to one of my favorite topics, and that is safety and quality in healthcare. I'm going to focus in on radiation therapy, but I think what else do you want except to deliver safe and effective care? So this underlies everything that we've talked about, and so I think it's also something that's quite interesting and complex to understand. There's a lot behind it. So I won't be able to talk about everything. And I'm going to focus on two particular specific topics that I think are pretty fundamental. One is incident learning. Okay, so when an incident happens or a near miss type of event, how do you learn from that and grow and deliver better care? And the second is risk analysis. How do you tell what your risk points are in the delivery of care? And we'll do that through something called failure mode and effect analysis, FMEA. So I'll go through each of these. The incident learning part we're going to split into two sections. In this video, I'm going to go through a kind of like a example event scenario. I'll show you how that works. And then in the next video, I'm going to talk about incident learning systems more generally. All right, here we go. So we're going to start here with a physician who has written a wrong prescription. Now, why that happens, I'll get into in a minute and what that means. But basically, the effect here is that they've written a prescription for 250 centigrade times 20 fractions, and that wasn't right. It was meant to be 200 centigrade per fraction times 25. Let's say that was per protocol. Then we'll draw the workflow out here. So it goes to a CMD, the Certified Medical Dosimetrist, the planner. And that planner is working off the wrong prescription, and so they make a wrong treatment plan or a wrong dose. At that point, it goes back to the physician for review. It's not caught, and then the planner checks it off and sends it on to a qualified medical physicist for review. And at this point, there's an opportunity, but there's a missed check by the physicist for whatever reason. And then it goes on to the radiation therapist, and it goes for treatment. So it goes to get treatment for 1 day, 2 day, 3 day, 4 day. And then at this point, there is a review. So maybe that's chart rounds, peer review chart rounds. And that's where this particular error is caught. So what would we call this particular scenario? We call it an incident. That's the term. And that means anything that reached the patient. So it got to the point of treatment, and it may or may not have harm. Let's look now at the dose here for this particular event. So we had 250 centigrade. Should have been 200. So that's a 25% difference. So in theory, that would be reportable to a regulatory agency in the U.S. That would be reportable to the state because the criterion is 20% in the U.S. But consider also that there are many fractions. So we've given 4 fractions at 250. We could give 21 fractions at 200, and the total would be 5,200. Should have been 5,000. And so that is actually a 4% error. So that's the effect of fractionated radiation, is that you can make up for some of the extra dose and subsequent fractions, but it is a problem if you're hypofractionating or using SBRT, of course. So now we're going to go back here. I'll erase this, and we'll consider a slightly different scenario. Again, the wrong dose, but when it gets to the patient, at that point, it's actually caught before the treatment starts. It could actually be caught by the patient. That seems a little odd, but it happens. For example, the patient might say, what do you mean I'm getting 5 weeks of treatment? The doctor said I was getting 4. They go back and review it, and it's resolved. So there are different ways that this can play out. And so I want to describe some of the nomenclature here. So if we go back to this picture of the event scenario, we'll see first the error. That's the thing that initiated the whole chain of events. There are other problems that happen along the way, like this missed physics check. Those didn't actually cause the error. They help the error to propagate to the patient, but they're something different. If we go down here to what actually happened, that is the incident. That's the thing that happened and reached the patient. If I go backwards here to the other scenario where it was caught and there was no treatment, this we would call a near miss, something that was identified and stopped before it reached or affected the patient. So let me summarize then. You have an error here that initiates things. That error kind of goes through and it may reach the patient. If it does, then this particular event we would call an incident. That incident could harm the patient if it's serious enough, or it might be an incident of no harm, but it still reached the patient. Or this error might be interrupted in some way before it even gets to the patient, and that we call a near miss. So these terms are pretty important to understand, and they're going to help you later as we go through this. Now I'd like to go over a model for how to understand errors and incidents. This is the Swiss cheese model from James Reasons, and you'll see in a minute why it's called that. So we're going to start here with the error again. And this error will propagate through, and here's the patient over here. Now, there's a barrier in place, and I'm going to draw this like this, and it has these little holes in it. In other words, the barrier is not perfect at stopping this error, and if it doesn't stop it, it leaks through the hole, and it goes towards the patient. So it's like a slice of Swiss cheese. So if you go back here, you can see that there are many missed opportunities. Like there's, let's say, the review by the physician and the dosimetrist that could have stopped the error. So that might be one of these slices. Here's another slice. Maybe this is the review by the medical physicist. Again, it's not perfect. It has these holes. And so the error can pass through. And if it passes through, it can reach the patient. Here's another barrier. This might be peer review. And maybe that stops the error. It becomes then a near miss. But if it doesn't work, there's a defect in the step, it can go through, reach the patient. So that's the theory. So going back to this event scenario, this is all really part of a larger system of incident learning, an incident learning system where you go through events like this and look at them. So first step is reporting an event when it happens somewhere. It's either an incident or a near miss. It might be reported, for example, by the therapist. And then it's very important to have the learning loop happen. So you have to analyze and evaluate this event. So the tool for doing that is root cause analysis, RCA. And it's a very important tool, and so I want to go over it in a bit of detail. There are a couple different things you do. First, you identify care delivery problems. And those are basically anything that can go wrong. The what. What went wrong in this event? There are many whats in this scenario that I described. And then the second aspect of it is that you look at contributing factors. So the contributing factors are sort of the why. Why did that go wrong? What contributed to making the whole event happen? So let's go back here. I didn't really describe this well, but over here with the physician, maybe they were discussing with the resident about the prescription, and there was some miscommunication that resulted in the wrong prescription. Maybe that's one of these contributing factors, the why. Down here, the dosimetrist, maybe there was some issue with education or training. Maybe it was a new dosimetrist, and that was a factor. Over here, maybe the missed check was a slip. That's the contributing factor, the why. With the therapist, there might have been no check. That's a care delivery problem. And maybe there's a policy or procedure gap that leads to that check not being done. So I'm going to go back here and zoom in on this one particular issue in the chain of events, which is the wrong dose done by the planner. And we're going to do a root cause analysis just on this part and ask, why did this happen? This might have been a point where the wrong dose was identified by the planner, but it wasn't. And so what we're going to do is ask a series of questions to drill down into this, and we're going to ask why and ask that repeatedly. So let me go quickly through these why questions. Why was there a wrong dose? Well, maybe this is an inexperienced planner that was doing the plan, so they didn't catch it as they normally would. Why were they there? Well, maybe the manager decided to assign them to this case. Why did they do that? Well, maybe they were short-staffed in the clinic. Why were they short-staffed? Well, maybe there is an underfunded in this group. Why is that? Maybe the value has not been articulated to the hospital by the leadership of the department. So this is kind of the root cause method, where you drill down asking why until you get to more and more deeper causal factors. So this approach to me is really very fundamental. What we're doing is asking why this issue happened and not pointing fingers at the person who did it, but trying to understand it at a deeper level. And so we're really looking at it from a systems point of view, systems thinking, trying to ask, why did that error occur? What were the factors that led that person to do it? And trying to arrange the system so the person is driven away from error instead of towards it. Now that you understand a little bit about what incident learning is and the different types of events that occur, I'd like to review very briefly some of the evidence behind it and some of the recommendations from professional societies as to what and why we should do this. So let's look at some data. This is from AHRQ, the AHRQ, the Agency for Healthcare Research and Quality. What we're seeing here is that the number of patient safety incidents on the y-axis goes down as you have more reports logged in. These are data from many, many hospitals in the U.S., and there's a significant anti-correlation. That might be surprising. You think more reports, that's safer? Well, it is, because as you put in more reports and you go through the issues and you resolve them and talk about them, and the overall system becomes safer. So those are some of the data, and now I'd like to go and look at some recommendations from professional societies. There are numerous of these from many organizations across the world, and they're essentially unanimous in the call for what to do. So I'm going to focus on the ones from the U.S. from ASTRO. Here's one recommendation. Each department should have a department-wide review committee which monitors quality problems, near misses, and errors incidents. Another recommendation: employees should be encouraged to report both errors, meaning incidents, and near misses. So the language from the professional society is very pointed. There is nothing in the regulatory realm enforcing this voluntary incident learning, but it's best practice, and the data strongly support its use. Incident learning is, however, a key component of the practice accreditation programs, and one in the U.S. is the APEX program from ASTRO, Accreditation Program for Excellence, and it basically says that if your program is going to be accredited, you need to be engaging in incident learning of the type that I described. All right, so with that, I'm going to stop. In the next video, we'll go on and talk a little bit more about incident learning systems in general, but hopefully this gave you a flavor of what this looks like in clinical operations. I'm going to leave you with a little further reading. Hopefully, well, it's not like too self-promoting to point to this review paper, which we wrote recently. This gives a pretty extensive overview of the whole issue of incident learning and radiation therapy. And there are a lot of other references as well around this topic that you can look at and learn more about. All right, we'll see you in the next video.